Before the Care Network, I felt hopelessness and didn't know where to turn for resources.
I'm able to get through things that I wouldn't have before, and they quite frankly saved my life.
We started Care Network approximately the mid to late 80s in response to the HIV and AIDS epidemic. At that time, and still, it continues to be very much in alignment with the mission of our health system, the St. Joseph Health System, and our values in terms of reaching out to the community and serving the most vulnerable. Today, Care Network provides chronic disease management and transition services to over 400 individuals, and we couldn't be more proud of the services that we provide.
The Care Network means a lot to me in this community in that we have a resource for our health issues related to HIV and other chronic illnesses. When I found out about the Care Network, it gave me a great sense of comfort that I had something locally. I didn't have to drive the long distance to San Francisco where there were many HIV organizations. I had it in my own community, and that does a lot for your own well-being. It's very difficult to manage a complex illness like HIV. The Care Network was very instrumental in bringing Dr. Conlon into the community here, who specializes in HIV, and it has helped many people through the years. The Care Network was always there for me when I needed help. It's an amazing group of people that have worked with them through the years, and the current staff is amazing too.
Over the past few years, we've seen an average of a 40 to 60% reduction in emergency room visits and hospitalizations for the patients that we serve. Because of our experience in this area, we are convinced that it's because we address the basic needs first. Food and shelter are significant basic needs that, if not in place and not secure, an individual is going to have a very difficult time managing a chronic condition. When we first began this work, there was very little in terms of evidence-based practice. So we pulled together a collaborative of our community partners to make sure that we covered all our bases. And over the years, more recently, as evidence-based literature has emerged, we're very happy to see that our practices, processes, and framework are very much in alignment with that evidence base.
In addition to receiving referrals directly from the hospital, we also receive them from other community-based organizations, our local community health clinic, and physicians. Once a referral is received, our interdisciplinary team begins to work with the client in creating their service plan and goals. Our core focus involves access to primary care, access to medication, and access to basic needs. Once these areas are met, we're able to focus on disease self-management and self-sufficiency. To address all these elements, we have found the average length of services to be 3 to 6 months. Because we are well integrated with the hospital's discharge planning, we are able to meet our patients in the hospital before they are discharged home.
I'd say that I was beyond rock bottom. I was seeking counseling, I was seeking help. I'd had a traumatic brain injury from a car accident. I knew I needed help. I got referred actually to them from a counselor at the shelter here in Napa. They aggressively returned my call by a visit, stayed with me through detox and the rehabilitation program, helped me get an apartment, they helped me straighten out my financial issues, and quite frankly, with Kendall's help, they managed to get my medical situation together. Kendall's a registered nurse, and as part of the Care Network, she came by my place, and she also arranged to get a regular physician and a psychiatrist. She accompanied me to the doctor visits and walked me through all of the things that I was going to have to do to deal with my health issues. We were able to uncover a lot of medical issues that were the root of my problem as well. I love the gym. I love this place. Cardiac rehab gets you moving, it gets you functioning, it strengthens your heart. They're very friendly, they're very nice to everyone here. They know you all by your first name, and they keep track of your progress, they monitor you. It really helps you mentally and physically.
Gracias por venir a la casa a hacerme mi medicina.
Thank you very much to your program. You helped me organize my medications. I don't know how to organize my medications. You come to my house and make me understand what they're for. Sometimes you order my medications or bring my medications, and you guys are very efficient in doing this. You guys work very hard. It's helpful to understand. I feel that after I got better health, you continue coming to see me, and I feel that you care about me. You opened doors for me. I had no idea there were doors to be opened, and there were people out there that could help me.
It's a great resource And from a need, it has grown into a full-flowered organization that's helped this community and is very much a part of this community nowadays.
I wouldn't be sitting here today if it wasn't for the CARE Network and all the fine people that work there.
It's very rewarding to know that the work that we provide through CARE Network absolutely increases the health and quality of life of the people we serve in Napa County.